And now it's my pleasure to introduce Dr. Jodi Edwards from the University of Ottawa Heart Institute. And she's going to talk about biomedical data management and sharing Exemplar.
That's okay though. I was just saying I received a different title than the one that was, so hopefully the slides I've prepared are of interest. I was asked to speak about data management plans for observational research. Yeah,
that's fine.
Yes. Great. Great. Okay, thank you. So thank you so much for the opportunity to speak here today. So as mentioned, I am primarily appointed, my research program is housed within the University of Ottawa Heart Institute, where I run what's called the Brain and Heart Nexus Research Program. And I also there direct what's the Population Outcomes Research Unit. So that is a research unit that's really dedicated to observational research studies, primarily with linkage with ICES data. So the use of population-based administrative health data to investigate questions around cardiovascular disease. So that's the setting that I come from, and I'm also the data champion for observational research within this initiative. So today I'm going to speak about research data management and specifically some of the considerations in the development of data management plans for observational research. Okay. They said that the arrows worked. Okay, all right. So thank you, sorry to make you stand up. All right, so just first I'll just mention I don't have a conflict slide here, but that I have no conflicts or disclosures to report. So brief learning objectives for our time together today. I'm going to talk a little bit about research data management plans, research data management in general, and why creating a research data management plan is a really important part of the research process. And I'm going to speak with this specifically coming from the context of observational research. I'll give you a little spoiler alert here. It's actually more complicated than you would think in the application to observational studies. So I'm going to highlight some maybe tips and best practices that people might be able to use to integrate DMPs into an observational research program. So research data management, I'm sure that everyone here is very aware of what research data management is, but just by way of sort of common terminology, this is from the Government of Canada website. So research data management refers to the process applied through the life cycle of a research project, really to guide all aspects of data with respect to collection, the documentation of it, storage, sharing, and the preservation of that data. So what are research data? We just heard in the prior talk that they can take many, many forms. It's really just referred to as the primary source that is used to support technical or scientific inquiry, research, and scholarship, used as evidence in the research process, and they're commonly accepted by the research community as necessary to establish research findings and generate evidence and results. So as mentioned, this can take many forms, from experimental data, data with respect to animal models, all the way up to, on the other end, clinical trial data, so more regulated, really randomized controlled data. My domain in my research program, in the unit that I reside over at the Ottawa Heart Institute, is really with respect to observational research, which can also take different forms. You can have prospective population-based studies or retrospective studies. So why RDM is important, the way we manage our data is important. These are just highlighting a few key points for why it's such an important part of the research process. First and foremost is that we want to kind of safeguard our data. We want to keep it secure and safe. We reduce the risk of data loss by having a kind of a rigorous research data management plan in place to ensure things are collected, stored safely and securely. I think it's kind of increasingly more important these days, with not only with privacy policies, but just in terms of cybersecurity issues, that we want to really kind of safeguard our data. We also want to ensure that they're accessible and shareable. So more and more, getting into the kind of realm of open science, journal publishers are really requiring that data are fully described, fully reported, and made available without restriction at the time of publication. This can mean that you just provide a kind of a transparent process to data access, or it can even mean that some journals are moving towards requiring that the data be submitted to a repository and available, and code as well. This applies both to the data itself and the analytic code. And also, we want to ensure that we're in compliance with new policies. So I think relevant to everyone here and every research entity in Canada is that the funding bodies, like the tri-agency councils, have introduced requirements for effective research data management. So now we have to be very clear about exactly the processes that we're doing for managing our data. We have to have explicit data management strategies at the institutional level. And this is again the link to the tri-agency policy is here on my slides, and they really highlight research data management as a necessary part of research excellence. And they want to also be able to support FAIR principles for research data management and stewardship. Okay, so that is data that is findable, accessible, interoperable, and reusable. So we know it's important. And the best way to really kind of outline and organize your research data management is to have a really clear, transparent, comprehensive data management plan. And I would recommend doing this right at the time simultaneously to like an ethics application. You know, it's right at that time you're kind of developing your protocol for your study, you know, figuring out exactly, you know, the methods and how, you know, how the data or the research is going to be conducted. So just developing a research data management plan in conjunction with an ethics application is a great start. So a data management plan is a formal plan that outlines how exactly you intend to manage your research data during and after the term of the research study. So there's numerous components of a good data management plan, and they can address these questions here, such as what type of data will be collected or created, what type of policies apply to the data at different levels within your institution, if there's any legal sharing agreements from the funding requirements, who owns and has access to the data, who will be managing it, you know, which just like in an ethics application, who within your research team will have kind of privy and access to the data, have you know, rights to kind of manipulate the data, what equipment and methods will be used to capture and document, how will it be organized and stored securely, both during and post study, and how will it be shared and under which provisions how will this look like, right? So there's lots of different components that you can kind of a priori think through and really detail out in a comprehensive plan. So this is just an example of a plan where there's different components that relate to each of these kind of topics: data collection, documentation, ethics, legal and security issues, how you're going to store and preserve it, and then how it's going to be shared. This is from the, there's lots of great resources. Most of the institutes have some kind of website dedicated to this right now. This one is particularly from the U of T website. I think it's U of T. This one might not be the U of T one. This is University of Zurich. Sorry, there's another one that's related to U of T, but most within kind of the library component of different websites have resources dedicated to this. And, you know, correspondingly, there's a number of different online tools that can be helpful in this regard. So you don't have to try and recreate the wheel. You don't have to come up with the data management plan on your own. There's several free tools that are available to kind of give you a draft and help you. There's templates that can help you, you know, kind of draft something with respect to your specific data. And also that meet the criteria for different funding requirements. So there's a couple different tools listed here that are used in the States and the UK, but DMP Assistant is the one that's really kind of best targeted for Canadian researchers. And it's a bilingual tool for preparing DMPs, and it follows best practices in data stewardship. And it just kind of takes you through step by step in the creation of your data management plan. So that's great. So there are lots of ways that you can kind of go about this. But as I mentioned, it depends on the type of data that you have. And as it turns out, in the observational realm, it's not always that simple. There's a lot of different considerations. It's actually more complicated than you would imagine. And this is specifically for retrospective studies. So when you have experimental data, clinical trial data, and even prospective observational studies, you're really under control of exactly what happens, just like your study design. You're the one kind of driving, you're determining how data are collected, according to a clinical trial. Of course, you have, your regulatory requirements, but you've set out the research question and you're, actually collecting and prospectively ascertaining the data. But when you get into sort of this world of observational research where you're using existing cohorts or administrative data sets, this is where your data management plan actually isn't that straightforward. So that's primarily what I'm going to focus on for the rest of the talk today. Some of the considerations that are really necessary for you to think through in depth when you're using kind of existing data, which I think is increasingly more common in observational research. So observational research, just a quick review, is those studies that draw inference from a sample to a population. The exposure is not under the control of the researcher. We are observing, some sort of exposure outcome relationship, and the goal is to draw inference about that relationship. And as mentioned, these can be either prospective or retrospective. Your data management plan is a little bit more straightforward, as mentioned in the prospective setting, because you have full control of exactly what measures you're going to use, how you're going to sample, exactly which control population you're going to use. Everything about how the research is going to be conducted is within your control and your design. And that doesn't necessarily mean that the data management plan isn't time consuming. There's still lots to think about, but it certainly can be done a priori from your own methods. But really it's when, as mentioned, you're going to start leveraging existing data or secondary data sources that things can get a little bit more complicated. So there are many, many different prospective cohort studies out there, and people are increasingly kind of leveraging, utilizing data that's already in place. So a big one in my world that is very common that most people are aware of is the Framingham Heart Study. This has been ongoing prospective cohort study for many, many years. Lots of measures, over a long time. They even have Framingham offspring studies where they're now studying the children and the grandchildren of the original Framingham cohort. So this is longitudinal data and very comprehensive. There's other cohorts, such as the ADNI cohort, which is another one I use regularly, which is the Alzheimer's Disease Neuroimaging Initiative out of the States. These are frequently multi-site, so they involve many, many studies, primarily, many of them just within the United States, but Canada, of course, has their own and international, different cohorts. The UK Biobank is a common data source that people use for sort of retrospective analysis of existing data. There's also the multi-center AIDS cohort. So there's, across disease, conditions. There's many, many cancer cohorts, AIDS cohorts, many now, of course, COVID studies, longitudinal COVID studies. So there is really no, paucity of data. So these are great resources, but they weren't designed by me. So when I look to go and kind of leverage this and use this data and have a data management plan in place, you have to have a lot of awareness of originally what was done way back when Framingham started, right up until modern day, to truly understand the data, the evolution of how the data were collected, and what that means for your data management plan. Secondary data are those data that are generated for a purpose really not primarily a research purpose. So these are administrative health databases. I use these very frequently, and many do in their research programs. As I mentioned, the Population Outcomes Unit that I am involved in uses ICES, which is the data provider in Ontario for all of the administrative health data, such as the CIHI data on hospital discharge abstracts, the OHIP database, which is the physician claims, physician billing database. There's the CCI component of the CIHI data, which relates to procedures and day surgeries. And then there's prescription databases. So we have, all these different databases that kind of, the health system, the wheels rolling of the health system, and all this information gets recorded, and then we kind of leverage that and use it for research purposes. So there are limitations, of course, of using these types of data sets, kind of applying it to a research question when really it's generated for an administrative purpose. And there are really important considerations for data management plans in the context of this data. So some of the things that you might have to consider are data quality and validity. So if you're not the one collecting these data, it's not your cohort study. So you really have to have an understanding of the quality of the data that you're going to be using and how valid it is. What kind of design was originally set out in some of these cohorts? What kind of sampling methodology they used? How data were stored and shared over the course of some of these longitudinal studies? What kind of linkage is performed amongst different kind of administrative cohorts? And then it's really important, I would say, one of the key components would be really to make sure that you align and abide by some of the data provider policies. And that's something that we're really careful about when you use ICES data. So I'm going to go through each of these in turn. So kind of tips, best practices for if you're going to kind of develop a data management plan for an observational study that is kind of leveraging existing data. So if you're going to be looking at an existing prospective cohort and you want to ascertain an analytic cohort, I call it a sub-cohort for some retrospective analyses. In terms of data quality and validity, again, you don't have control over it, but you can just really kind of probe it a little bit a priori. I think it's really important to do that both for prior to developing your analytic plan and understanding, some of the limitations, but also for your data management purposes. You can request a priori description of the completeness of the data, how much missing data there might be. That, of course, gives you a little bit of an insight into the quality of the data, the validity of the data. You can try and confirm the consistency of the data over the years of follow-up. So, of course, these cohorts that go back, way back when, like Framingham, it's a long period and things change over the course of how these long-term studies work. So you can try and just see if you can get information about the consistency of their processes. You can try and investigate as well some changes in the data entry and quality procedures over the study term or across different sites. So as these big cohort studies go, more and more sites go on, and of course that leads to kind of variability in terms of how the data quality procedures are implemented across sites. So that's an important thing to know when you're trying to develop your data management plan and talk about how your own data quality. And then you can describe, so I would recommend kind of when you're using these retrospective, when you're doing a retrospective analysis of an existing cohort in your data management plan, you kind of have to describe the original cohort and then also describe your own study. So describe the processes for how you ascertain the cohort for your specific and kind of current ongoing study. So it's a bit more involved data management plan, I would say, in this case, because you're a little bit incumbent to describe some of the original design features and data quality practices, but also describe your own methods and processes for how you're going to do that with respect to your analytic cohort. When you're using administrative data, again, we want to try and get a sense of the correctness and accuracy. So just because there's an ICD code for something doesn't mean that it's actually kind of consistently used in that manner for that exact diagnosis. So, if your kind of coding administrators become your best friends, if you have to try and, ascertain some sort of cohort, you want to understand really how these codes are being used. You can describe and cite the use of a validated algorithm. So in every case, whenever I'm using administrative data, I try and use a validated algorithm for case ascertainment. And if there's not, then you really want to try and investigate with your coding administrator, but validated algorithms wherever possible. And then in your data management plan, you'd want to describe that, of course. Describe any quality control and validation processes used by the data provider. So CIHI has a number of different, validation confirmation studies. They regularly do kind of audits of data quality, ICES as well. And then there's some quality assessment tools that are available that might be able to kind of guide you with respect to creating your data management plan and describing these big administrative data sources. So it's not as straightforward as just planning what you're going to do and collect the data when you're kind of reliant on what others have done, beforehand, or what government bodies do in terms of administrative data. With respect to design and sampling, again, if you're using undertaking a retrospective analysis of a prospective cohort, as mentioned, I really think it's important to probably outline the original design, because you actually inherit any biases that were embedded in the original cohort study. If you're doing a retrospective analysis, I mean, you get those biases as well. So you want to be very clear about how their sampling, what the original design was, how they were collecting, what measures were used, what their sampling methodology was. Typically in some of the bigger cohort studies, there's quite detailed documentation on the study website or from prior publications. They often have kind of a foundational methods design publication. So those can be quite helpful resources for describing this. And then again, you want to also describe your kind of current design and how you're going to then undertake some retrospective analyses. Just a little brief note that the data management practices and with respect to the design and sampling of many of these studies, they can vary substantially both over time and across jurisdictions. So for example, the UK, with the UK Biobank data, it's a very different system and way to kind of engage individuals in research process than in the States and some of the bigger cohorts there like Framingham. With respect to administrative data, and design and sampling is a little less of an issue. So you would probably focus primarily on describing your current retrospective design. But again, you would want to highlight how exactly you ascertained your cohort and the process for that, and clearly describe any matching or weighted sampling methods. So this is common in kind of epidemiological research. People often might use, try and go to the population cohorts, kind of leverage the very, very large samples to perform some kind of, propensity score or let's say matching. So if you have any of those kind of analytic or design features embedded into your current design, it's important to talk about within the administrative data, how your process for how you basically go and find those matches, or how you weighted your sample. Okay, so storage and sharing. Again, this gets a little bit more complicated when you're not the one that originally kind of stored the data, and also there's a kind of another layer of process involved in data sharing agreements with some of these large cohorts. So to what extent possible, I think in your data management plan you can describe the original storage study methods, study storage methods. You can describe any data sharing agreements that you undertook with the original cohort and sharing processes involved in your acquisition of the data. So in my research program, I've got access currently to 2 cohorts, the cardiovascular health study and the regards cohort. It's a racial differences in stroke incidence cohort. They're both American population-based longitudinal studies, and they actually involved really specific and lengthy data sharing processes in order to get access to the cohorts. There was quite a number of differences across jurisdictions between how the American system shared data and how in Canada we have some regulations around it. So it was quite lengthy to actually execute those data sharing agreements. And so it's just a note that this can take some time. And then also the more you can kind of think through it at the data management phase, I think you can kind of get a leg up and start to initiate some of these things at an earlier stage. So it's a very big learning process for me. So you can thoroughly describe your data storage and especially with respect to kind of privacy and sharing procedures for the current study as well. So, you're in receipt of these cohorts and we want to ensure, encrypted sharing, no anonymized, there's absolutely no identifying information, things like that. Those are really critical components of your data management plan. And then with respect to administrative data, you're not really kind of storing the data as much. I mean, no one really stores the data, like ICES, for example, the data doesn't get released from ICES ever, the administrative data. it stays on site. It is stored only with the provider, but they have really explicit and clear policies around that you'll probably want to cite within your data management plan. Linkage. This really is kind of most relevant to the use of administrative data, but I think it's an important component to include in a data management plan, really how that integration happens, especially when you're using multiple different data sources and you're trying to federate them, link them together. It's important to describe those integration methods if linkage is incorporated in your design. And using multiple databases, and also I think to describe the linkage type. So whether it's sort of a probabilistic or a deterministic linkage, the manner with which you do that. So probabilistic are generally applied more readily when maybe the data quality isn't, the integrity of the data isn't as high, whereas deterministic linkage, you can really do it kind of at an individual level using an identifier such as a personal health number. So I think that describing the linkage process in your data management plan is just useful in terms of understanding the kind of integrity of the data as well. And finally, I think, as I mentioned, this is a bit of a busy slide, but this is probably one of the most important things, is if you are engaging with the data provider, such as ICES, and using administrative data in your data management plan, you have to just have a real awareness and kind of align and compliance with their specific policies. So for example, there's two examples here that I wanted to share. ICES, as a provider of administrative health data, is what's called a prescribed entity. And this allows them to kind of compile these data and the statistical information and conduct analyses without patient consent. So it's for management of effectiveness and effectiveness research with respect to the health system. So they collect these personally identifiable information without this consent. So they have really strict, because of that, they want to preserve their prescribed entity status. So there's very strict policies with respect to privacy, small cell reporting. There's no way that you can kind of publish anything that might be re-identified. So there's a lot of processes in place, really, careful policies around risk re-identification. And so it's important in your data management plan to understand your data providers' policies, adhere to them, include them in your research plan. And also with respect to data sharing. So if you're going to publish a paper that uses these types of data, and you have to include some sort of data sharing or data access statement, an ICES paper has a specific, there's a formal statement that must be included in the publication, and it indicates that the data are held securely in coded form at ICES. So it's not the same as just making your own research data available to whoever wants it. So a legal sharing agreement can be initiated between ICES and a data provider. Well, they have agreements with their data providers that make it impossible for this data set to be publicly available, but access might be granted if someone meets criteria to allow confidential access through what's called their DAS system. So I think it's just really important to have an understanding of some of these policies because they apply to your retrospective analysis if you're using those data sources. So I think that those are sort of some of the key messages or the tips and best practices that I wanted to share with respect to data management plans for observational research. As I said, really it's the secondary use of data in the retrospective setting that it becomes a little bit more complicated. You have to do a bit of investigative work in terms of kind of what the original studies have done or what the administrative data providers do. But I think the key messages are that research data management and data management plans in general are a really important part of the research process. They're now required by the tri-agencies, and they really help you kind of, a priori set out a nice, clear, transparent recipe for yourself to protect your valuable work. So they're a good tool for yourself as well. There are many considerations for DMPs in the context of observational research, particularly with retrospective analyses of existing cohorts or administrative data. But the good news is there's lots of tools out there to help you and resources available for you to create your DMP and make it a really seamless part of your program if you are conducting observational research. So hopefully that was insightful. Thank you. And we'd be happy to take any questions.
Thank you so much, Jodi.
Yeah.
Let's see if I'm intelligent enough to figure out whether there's maybe stop share. We don't know. There's no online questions. So any.
This one from the. Okay. I don't think there's a mic, but I can repeat your question.
That would be a little tricky to be. I very much appreciate variation, right? It expects me that there's one lesson is as perhaps a junior researcher or somebody who doesn't want to be able to be spending a huge amount of upfront time. There's a tremendous value in linking up with existing groups. So, for example, in Canada, we've got the Data Research Network, trying to link up not just in terms of access, but also technical interoperability of the systems. The amount of work they put into that human resources is huge, and so as a researcher, it's great to find out where these groups are and do they have information. But with your experience you had with a variety of things, and others, there's a variety of kinds of intake processes. Can you describe it all in your experience in terms of the variation you've encountered, how helpful they've made it?
Yes.
I mean, part of it is, do they have what you need?
Yeah.
But part of it also is, what do you need to offer by way of selling your firstborn to get access to the data?
Yeah, agree. So yes, in my experience as well, there's a lot of variability, across cohorts with respect to kind of the process involved in data requests, data access. ADNI has been very straightforward. You sort of send them a brief outline of what you want to do, and you get the email and you can download the data. Others have been a little bit of a barrier, I would say, in terms of engaging them and actually using their data. They have a very convoluted system of with a review committee, and at every stage you have to resubmit things and get approvals. And I still have some in publications that are just going back and forth with their publication review committee before I can even submit for peer review. So I think there's a wide variety. So it has been pretty eye-opening for me to work with the different cohorts. Not to say that I think that just easy access is necessarily the right thing. I think like having oversight is important as well. But I think that the providers should really be there in a more facilitatory role and not be a kind of a barrier to publication. So it depends, but yeah, it's been interesting. But I think the more, like you say, we kind of organize and kind of consolidate these resources within these networks and have templates for how to do this, and young researchers can kind of benefit from the experience of people who have gone through this process before, then I think the better. It just helps to ease things and facilitate rather than make it some sort of arduous and time consuming. Yeah. Thank you. This question here.
Yes, hi, I'm Evelyn from Department of Pathology. I don't know if you can share one or two papers that you know of, maybe in your area, that were really successful in this retrospective use of existing cohorts. So because I find if I'm planning something, it's nice to read a really good paper that's published using the technique that I'm interested in. Is there anything that comes to mind that you can share with us?
Sure. I mean, there's many kind of really high impact retrospective analyses of existing data. I mean, of course, I'm most familiar with my own publication list, but I have a paper in the Journal of American Heart Association where we used ICES data to develop prediction models for looking at stroke outcomes with markers of what's called atrial cardiopathy. So, you can really kind of, in really neat ways, combine some of these administrative data sources. We combined data from echo and ECG, and then we integrated those with clinical features, medication information. In that way, you can kind of develop a really comprehensive prediction tool for long-term outcomes. In that case, it was mortality and stroke. Yeah. So that's one example, but there's many others, I'm sure, from lots of other domains. But yeah. Oh, thanks. Yeah, thank you. Yeah.
Okay, thank you.
Okay,
again,
thank you so much.
Jodi, very much.